How do people react when you tell them you're an actuary? Well, I can remember when I told someone I was an actuary and she was like, oh, cool, you must be really smart and good at math. Another went mute for like 5 seconds with her face suggesting a deep thought. And then he said, do you get to dive a lot or just walk in submarines? I didn't know what to say. And I bet you've had similar experiences. But I guess the first person wasn't far from the truth. In fact, according to Investopedia, an actuary uses math and statistics to estimate the financial impact of uncertainty and help clients minimize risk. But does this mean we can't apply our solid analytical skills in managing uncertainty to understand human behavior and manage today's complex socio-economic challenges facing society? By the end of this video, I hope to convince you that actuaries have a more significant role to play in solving today's complex socio-economic challenges that have far-reaching implications. To borrow from Kenya's presidential address at the United Nations 77th session, and I quote, "We recognize the crises we must confront are interlinked in a complex way. They can only be effectively addressed through more imaginative strategies and innovative formulas. As actuaries, we convert our imaginations into probability distributions. This way, we can capture all possibilities from the most optimistic to the most pessimistic. We can therefore attach a probability to different outcomes and use this to make policy recommendations. One of the latest developments in health economics is the application of microsimulation models to estimate how demographic, behavioral, and policy changes might affect individual outcomes and to understand current policies' effects better. This involves making guesses about the best estimates of future events, but we, however, know the guesses about the future will almost certainly be wrong. Therefore, there is scope for actuaries to combine mathematical statistics and probability to measure and model future uncertainty using these models. But what exactly is microsimulation? Microsimulation is a highly detailed computer modeling technique that operates at a unit level. These units can be a person's, households, or items. In health economics, the units are individual since we are often interested in the health outcomes of a given intervention on a given population. These individuals differ depending on a combination of factors such as age, gender, etc., who are selected so that their characteristics reflect real-world population. Each person has a unique identifier and set of attributes, so you can think of it as a virtual person with all the characteristics of a real-world person. Microsimulation models are then used to simulate individual pathways, which are consequently used to simulate the impact of interventions of policies. The model works by cycling through the lifespan of each individual twice. The first time, the model describes the world as it is. This is called the base case. The second time, the model uses the same virtual people to test different scenarios and evidence-based interventions. This is done by running the same model, except changes in only one way to include an intervention. The two sets of results are then compared, with the difference between the base case and the intervention showing the impact of implementing the intervention. The results are then used to inform policy recommendations that would benefit the target population. Therefore, it is vital to show the uncertainty inherent in such estimates to ensure optimal strategies are implemented and an appropriate level of preparedness for other likely outcomes. Allow me to illustrate this using a microsimulation model we have developed. We have developed a microsimulation model to estimate malaria costs in Kenya and generate evidence to support vaccination policy recommendations. More specifically, we use it to assess, among other things, how much the government will need to invest to increase malaria treatment availability and how government spending could be better targeted to improve the outcomes. So we applied microsimulation models to create a statistical model of virtual people with real-world characteristics. We then simulated these virtual people as they make choices. At each stage, we incorporated the uncertainty involved in making a choice by estimating a range of possibilities and defining a set of rules for choosing these possibilities. In a more relatable jargon, actuarial jargon, we define probability distributions for different choices and sample parts. This is what we found. 2 in 5 hope their sickness will self-resolve and don't seek medical attention. 3 in 10 with symptoms but without malaria given antimalarial medication, while 1 in 10 who test positive for malaria don't get treated because of antimalarial shortage. So what were the implications of these outcomes? Better outreach to encourage people to seek medical attention and testing for malaria before prescription would significantly reduce the very high malaria mortalities. In fact, UNICEF estimates that every 75 seconds, a child under 5 dies of malaria. Additionally, over-prescribing antimalarial would result in drug resistance, which could be more costly. It also highlighted the importance of appropriate stocking of antimalarials. We also evaluated the impact of vaccination. We established that a targeted investment of about $1.2 million to stock antimalarial medication dispensaries and health clinics, the lowest point of contact with the public, would on average prolong lives for 3.5 more years than if the same amount was invested in the vaccination program. This is about 4% of the current malaria budget. With constrained budgets, these outcomes ensure we utilize the limited resources optimally, improve health outcomes, and help the 5 children who lost their battle to malaria since I started talking, so they can actually stay alive and hence bridging to a better tomorrow.